Welcome everyone. If you haven't seen me or heard me yet this week, my name is Andrew Smith. I am the Community Engagement Program Manager here at DBSA. And I talked in the last session a little bit about my role in being responsible for DBSA's state level advocacy efforts across the country. But what I want to talk about today or now is a little bit more of the other part of my role, which is finding and identifying and assisting peers who are interested in sharing their story and helping them with that process. We talked in the last session about the reason for DBSA advocacy. The reason any of us are here is in order to invite peers to join us in the process of advocacy in order to support their own wellness as a tool in their wellness toolkit. And so we talked in the last session about what DBSA is doing as far as public policy is concerned. But there's a lot of policies that affect people living with mood disorders. And not all of those are laws. Not all of those are the government. Individuals, private companies can have policies that have effects on people living with mood disorders. And so the peer council is one of the ways that DBSA is amplifying the peer voice in order to bring the peer perspective, give peers the opportunity to talk directly to people that are making policies that could have an effect on them. It gives them the opportunity to share their experience and to shape the options that are available for themselves and for other peers out there in the community. And again, circling back to why we do what we do, that giving peers that platform, giving peers that opportunity to speak out publicly for their own wellness sake. So once again, we're going to use our polling software, our interactive polling software. If you know how to use a QR code, you can scan the one that's on your screen now. We are going to have the opportunity to answer some short answer questions. If you would prefer to use the keyboard on your computer, you can also go to slido.com, SLIDO.com. And if you do that, you'll get a screen that looks like this one. And in the blue box that's at the top, you want to enter all one word, no spaces, advocacy track. It doesn't matter what's capitalized. It's not case sensitive. And that is the code that we've been using all week. And whether you scan the QR code on your phone or you go to slido.com, then the next screen that you will see is a list of days and times. So please select today and 4 p.m., which is what time it is here in Chicago. And my name is Andrew. And I believe that is color-coded blue. The screenshot that I have here cuts off right after Thursday at 3 p.m. But the very next one down on the list is Thursday, 4 p.m., Andrew. And again, I believe that's blue. And when you do that, then the next thing you're going to see is our first Slido question. And the question is, what words come to mind when I say amplify the peer voice? So take a moment, think about that expression. What does that mean to you? what words come to mind when you hear that? What does that conjure for you? So we've got a couple of responses: advocacy, communication, knowledge, sharing, voice. So yeah, a lot of different sharing the lived experience, and strength, having strength in numbers, moving the conversation forward. Yes. So that is our goal. That is what we do. Our goal is to provide a platform in order for you to be able to share your experience publicly. One of the ways that we do that is by convening peer councils. And a peer council is a group of peers, which is the word DBSA uses to describe people who identify with a lived experience of a mood disorder. Peers are people who share something in common. So we often call other people who are the same age peers. There's any number of qualities that people can have in common that they would share, that they would call peerness. But that's the word that we use to describe people with a lived experience of a mood disorder. And a peer council is simply a group of peers that will get together and share their feedback, their reactions, their experience, whatever the case may be. So it looks like we have strong participation in peer councils here on this call. So hopefully you get something new out of today's discussion about why we do peer councils, what they do, and how we do them. So we have a couple of people who have not participated in one. So the purpose of the peer council is again to share that perspective with interested parties. One of the things that it also does is it engages peers with DBSA. I talked in our last session about the Making Mental Health Matter newsletter, why we publish it, what kind of content we contain in that newsletter. This is just another way that we have a touch point that we can engage with you, our advocates, with peers. And so we're going to talk about some of what it looks like and how we make it happen. But when we provide that platform to you, then it amplifies all of our voices and gives us the opportunity to improve the quality of treatments that are out there and access to treatment. And again, DBSA does not endorse treatment. We don't endorse any particular type of treatment. But what we do is we fight for access. So we talked a little in our last session about some policies, some legislative and regulatory advocacy that we're involved in order to increase access to quality mental health care, which is one of DBSA's key policy issues. But now we're going to talk about when it comes to what that care looks like, how you can be involved in shaping that process as well. So the goal of a peer council is it's an opportunity for DBSA's advocates, that would be all of you, to share your peer experience and your peer perspective. It also gives our partners, the people who want to hear from you, the opportunity to improve the treatment options that are available to all of us, thereby making us stakeholders in the process, as opposed to consumers. And I use that word very thoughtfully. I know that's a word that the wellness movement is moving away from, but that's really all we would be if we were just taking the treatments that were available on the shelf to us. But instead of just consuming, we're actually shaping the process. And then it also raises awareness to that partner audience about the peer perspective. We talked about reducing stigma in our last session. One of the biggest ways to do that is to have direct interactions with people with lived experience. So what are some of the ways that we accomplish these goals? Well, first and foremost, we have to demonstrate to peers that there's a reason for them to participate in this process with us. And then we have to educate those partners on the priorities and challenges of peers. What's important to us, what's important to people with lived experience. And then we also want to foster the collaboration between DBSA as an organization and the partners who are interested in hearing directly from peers. So some things that I've learned over the process of this is that in order to get peers to participate, we have to demonstrate the value. We have to figure out what makes you want to participate in this process with us. And then one of the biggest things that we've learned through this process is how important language is. That language can turn people off to treatments that may be highly beneficial or to participating in that process. And so one of the big things that DBSA does as an organization and that our peer councils do is actually help partners discover the language that's appropriate. And next, I want to ask you how you would rank each of the priorities that appears on your screen in order of importance to you. And I'll give you a moment to make some responses there. I did have the list that I was going to read out loud, and now I don't see it, but I'm going to join the poll myself so that I can see it. And that's treatment outcomes, shared decision-making, side effects, peer-centric language, and whole health, which is the idea that your treatment and how it affects every aspect of your life, not just symptom mitigation. So looking at the responses from all of you here, it looks like at the top of the list is, what does the treatment do? Is it going to accomplish what I want it to accomplish? Then we see shared decision making. So does my provider make the decision with me? Am I the driver, or is my provider prescribing things as the quote unquote expert? And then right in the middle of the pack, we have whole health. So you can see that side effects is down toward the bottom of the list. And that's one of the things that we've learned is if the treatment's going to do what it says it's going to do, many peers aren't concerned about some side effects. Now, that's not true for all side effects, There are some that are no-goes, that are non-starters. But that's one of the things that we've learned through this process. So some of the reasons why partner organizations, these would be the people that are actually developing treatment options that are available, would be interested in convening a peer council, would be interested in hearing directly from you, the peer, is they want to know what are those treatment outcomes that you're interested in. One of the things that just to give you a little taste of the next session that we're going to have right after this one, talking all about peer identified treatment outcomes, is the measure, how many times in the last 30 days did you feel sad? What if I, as a person who experiences depression, don't care about that? What if I'm sad all 30 days, but I care about something completely different? Did I get out of bed and go to work? So asking the actual end user, the person who's going to receive the treatment, what's important to you? What do you want this treatment to do for you? And then what are some acceptable trade-offs? That being side effects, things that if it works, if it does what it says it's going to do, what are you willing to work with? What are you willing to accept? What are you unwilling to accept? What's gonna, doesn't matter how great the treatment is, if it has this, then no, we're not going to go there. And then one of the things that we convene peer councils for is effective recruitment around research and clinical trials. So often our partners will come to us and ask for a peer council to review recruitment materials to make sure that it's appropriate and acceptable for recruiting other peers to participate in the process. And we'll talk about that more as we go on. Another thing that we'll review is clinician education. These are materials that teach regular doctors, just psychiatrists, MDs, primary care physicians. Here are the treatment options that are available out there. What we do is engage as stakeholders to make sure that that language and all of that content is appropriate and respectful to us as it teaches our doctors and our providers about available treatment options. And then peer education as well, that information that's disseminated to the general public, to people who might live with a condition. Ask your doctor about blah, 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 blah. Well, is that language going to be offensive? Is that language going to turn me off? And I'm certainly not going to ask my doctor about it because I don't like the way they characterized it. That decreases access. If it's a miracle drug, if it's amazing and does exactly what it's supposed to do and works perfectly, but I'm not interested because I was offended by the content of the marketing materials, then I don't have access to it. And so that's another place where the role of the peer council increases access. And all of those last things that I just mentioned involve language, involve making sure that it's appropriate, respectful, not offensive, in order to keep the conversation moving forward. So what does DBSA as an organization bring to this process? Well, first and foremost, we educate our partners about the need to talk directly to peers, to have peers in the process from the get-go, that moving the peer perspective upstream in the process improves those treatment outcomes. That you can't just come to us at the last minute and ask us to make sure your marketing materials are appropriate, but that we have to be involved at every step of the process. And before anything even gets to the peer councils, it actually goes through DBSA's organizational staff to make sure that the language is appropriate and also that the approach, that the overall direction and goal of the communication is appropriate. And then we also identify how the peers and the partners can benefit from interactions with each other. So what is the experience of participating in a peer council? So first and foremost, I need to educate peers about the opportunity, what's available, why is it important, how it can benefit the partner, how it can benefit you to participate, how it can benefit other peers for you to participate. Then I also need to receive informed consent, and we're going to talk on the next slide about what we use that for, and then we actually schedule our meetings. Sometimes that involves meeting in real time, and we've been doing that virtually even prior to the pandemic because we do recruit from across the country, and so we can't get everybody into one room, and so we meet via Zoom, but we do meet in real time, which means we have to make sure everyone's available. And I'm going to talk about recording on the next slide as well. And here's where we recruit. We have DBSA's listserv of 8,000 advocates. That's the same audience that receives the Making Mental Health Matter newsletter. That's the same audience that receives our action alerts. In some cases, we will reach out to our chapter leaders who will then make their decision about whether it's appropriate to reach out to support group participants and offer the opportunity to participate. We also have our broader audience that receives the DBSA e-update newsletter. We also post about them opportunities on our website and on our social media assets from time to time. So sometimes we meet in real time over Zoom and we'll have a discussion. Other times we'll actually, we won't meet in real time. I will email members of the peer council, here's some materials, here's some questions. What are your thoughts? What are your feedback? And then the peer council will respond back to me via email, and I will compile all of that information and share that with our partner who's interested in hearing from them. But other times when we do meet in real time, we'll use Zoom's webinar feature. And if you're not familiar with Zoom webinar, it's one of those calls. We're actually going to have one for our next session here in the advocacy track. It's one of those calls where only certain people show up on the screen and other people can show up and watch what's happening on the screen. And the reason why we do that is to allow for that two-way mirror, if you will, the opportunity for the partner to observe what's happening and ask questions in real time without their presence being a distraction. We always make the council aware of their presence, but we don't want the little box on the screen that's just going to make people wonder, okay, what's going on there? And so that's why we use that feature. The other is we use first names only on your little box, and when addressing you directly and talking, just for confidentiality's sake. We do record those meetings for the people who are watching in real time so that they can go back and review if they would like, also so they can share with other people in their organization who maybe weren't able to watch it happen in real time, but that would also need to hear what was said. And that recording is audio only. We don't share the video recording of the Zoom call. The other thing that we do is we'll transcribe that audio recording, and we provide that to the partner organization. When we do the transcription, then we will remove even the first names. So with the audio recording, we don't bleep things out. We don't try to edit it in that way. But when we write it down, then we don't include first names. We'll just say participant 1, participant 2, participant 3. With both the audio recording and the transcription, those are for those partner organizations only to share within their organization. They do not have DBSA's permission to share that with anybody else. So sometimes those need to be shared internally because there's somebody else who needs to be a part of the process, but they're not welcome to share those outside of their organization. So now we're going to talk about the reasons why peers might be interested in participating in a DBSA peer council. And so I'm going to ask you, would you please rank these motivations on why you would be interested or not interested in participating in a DBSA peer council? These should appear in random order on your device, whether you're on your computer or your phone, but in no particular order. These are personal empowerment, opportunity to express your concerns, increasing access to treatment, being compensated for your time and participation. So that's talking about money, which we do pay honorariums for people who participate. Improved treatment options, and being able to transform what it means when we talk about wellness. So here's some responses so far. I'll give another moment for people to respond. And while we're doing that, it looks like a fairly even spread. Looks like the most common responses are being able to improve treatment options and an opportunity to express your concerns, followed then by increasing access for other peers. So thank you all for sharing that with us. And that is the list of responses that we heard from people who do participate in peer councils, and that's what made that list. And thank you for sharing which of those are most important to you. So now I want to talk about some of the things that we've learned as an organization from convening these peer councils. Okay. But first, I want to ask you, in terms of priorities in your own life and what you're seeking out of treatment, what would be the most importance to you? And so, again, we have another list here, and these should appear on your screen in no particular order. But please rank in importance to you the ability to thrive, symptom mitigation, integrated care, your privacy, understandable language and an opportunity to share your concerns. I'll give that just a moment while you respond. So we have the ability to thrive seems to be way out in front. And that goes back to that conversation about whole health and the effects of on your whole life and the choices that are available to you. A lot of people expressed concerns about privacy. How is your information going to be used? If you choose to participate in a peer council, what is that? What information are our partners going to have? If you choose to participate in a clinical trial or in research, how is your information going to be used, and what information is going to be able to be tied back to you? And then an opportunity to share concerns. So I think that's a large argument for participating in a peer council. Interestingly here, symptom mitigation is not down at the bottom, but that did rank fairly low among people who participated in peer councils. That yes, I want the treatment to do what it says it's going to do and to treat the symptoms, but really that ability to thrive. Am I able to live the life that I want to live is a much more important question to most of the people who have participated in peer councils. Thank you all for sharing your perspectives with us here. I also have another question for you. This is a 1 to 5 star rating response. 1 being, I'm not very sure or don't have very much confidence in my understanding, to 5 being, I'm very confident of my understanding. How would you rate your understanding of the clinical trial process? And I'll give everyone a moment to respond to that as well. So we have a couple people right in the middle, but the overwhelming majority feels like they've got a B plus understanding of how clinical trials work. One of the things that we've learned from doing peer councils is the general public, and this is not unique to peers, this is just a general public thing, but our role is to educate peers, that the general public doesn't really understand how clinical trials work, what the process is. And so when we were throwing around language like phase 3 clinical trials, and we were getting questions from members of the council saying, do you even know if this thing is safe? And so we had to go back and educate, oh yes, actually phase 1 is it safe? Phase 2 is, does it do what it says it's going to do? Phase 3 is now the comparing it to a placebo. If you take the treatment and you have a group randomly selected there, and you have another group randomly assigned to take a placebo, do you see a difference? Do you see a change? And so there's just a broader need for education around the whole process and engaging people in that process in order to get people to participate in clinical trials. Another thing that, another key finding that I've come across in my role is that if I'm concerned that treatment hasn't been proven effective on people like me, well, I'm people like me. Am I participating in the process? Am I engaging in that process in order to make sure that I have representation in that process? Now, that's not for everyone. Not everyone feels comfortable participating in research and or clinical trials. But that's one of the big things that I've taken away from this process. And then we also don't want to pander to people. We don't want to use language that is just going to make people feel good about themselves, but not actually help in any way or provide any valuable information to them. So one of the peer councils that we convened over this past year was around a media kit about how depression feels. What that was is a physical kit that would be given to journalists that was supposed to mimic some of the experiences of depression, and then give that journalist the opportunity to try out the items in the kit, see how it felt, and write about their experience of that feeling in order to help other people who don't necessarily experience depression to understand what it's like for somebody who does. These could be things like a weighted backpack to experience feeling weighed down, packaged food, prepackaged food that is intentionally tasteless to have the experience of not being able to fully enjoy things like eating, glasses that are that mute out color to have a sensation of not feeling completely engaged or connected. And so we convened a group of peers to review items in that kit, and there were other items as well, to talk about what their experience is like and do they think that items in this kit are accurate or not. Some of the things that we took away from that were quotes like this: the isolation that depression patients feel is isolation on steroids. It's so much more than the temporary isolation that individuals are experiencing as a result of other causes, like the pandemic. Depression is like sitting in the same place for a long period of time and trying to live your life from that one place. No matter how much you do, or who you talk to, or how much you try, you can't move. Depression creates a constant feeling of being overwhelmed, overstimulated, and when I was in the most severe part of my depression, I can remember looking out my window and thinking, I'm not going out there. The world is moving way too fast. It's just safer and more control in here while isolated in my house. A couple more quotes on the same, from that same group. I don't want to be around anyone. I'm hyper concerned about how others will perceive me, and I feel like I can't explain how I'm feeling or interact with others in a normal way. My depression makes communication difficult. I'm trying to communicate to others in a language they don't understand. When you change medications, there's a grueling wait that you go through where you're trying to find something that will work therapeutically. It's such a difficult process. And it's like I'm seeing life from the outside in, all alone. So I mentioned earlier that the main place that we recruit from for our peer councils is on our DBSA advocacy listserv. Here's that link. I'm going to actually type that into the chat, and I welcome the Q&A. I know that people have been typing your questions, and so Meg, I'm going to ask if you would be willing to read any questions. We can also, for people who don't want to type, if you could raise your hand, we can have Meg unmute you and you can ask your questions verbally as well. Do we have any questions, Meg?
No questions as of right now.
So one question was, can one volunteer for a peer council, or are they by invitation only? And so you can definitely step forward and throw your hat into the ring. When we get a peer council, most often we will first recruit here at, if you sign up at the listserv for at dbsalliance.org/take action. There's often a specific requirements that they're looking for. They're dealing with people with MDD, or they're dealing with people who, and that's major depressive disorder, or they're dealing with people who have bipolar disorder, and they want to talk to those individuals because those are the people that would be who would be using that treatment. And so those are the perspectives that they're interested in. Most common question I get when I send out a recruitment and it's for depression, what about us with bipolar? What about when it's for bipolar disorder? What about us, people with depression? There's always going to be another peer council. There's always going to be another opportunity to share your experience. Other times they want to talk to somebody who's tried a certain number of medications. Sometimes they want to talk to people, and sometimes that's a lot, and sometimes that's one or two. Sometimes they'll want to talk to people who have been diagnosed for a certain amount of time. And again, sometimes they want to talk to people who have been newly diagnosed and are just going through the process of figuring out what all of this means. Other times they'll want to talk to people who have treatment-resistant depression, meaning they've been around the block, they've tried lots of different treatments, and nothing has worked for them. And so, yes, you can always respond to a recruitment communication, throw your hat into the ring, but then I go through the list and see how you've responded to our pre-screener. We always ask some just questions about your experience to see whether that's a good fit for you. I had a question, how many peer councils does DBSA do in a year? Right now, we're on track to do about between 6 and 8 of them in a year, which is between about once every 2 months, maybe a little more often than that. Meg, I see that there's more questions.
You actually just answered it.
Yeah.
And so what about those of us who don't use medication, only do natural treatments? We do get peer councils from any number of partners that want to know from peers. Often those come from people, from partners who are developing treatments. And so they will want to hear from people who have tried treatment, or in some cases for people who aren't on any particular treatment if you've tried them in the past and they're interested in knowing about your experience and why don't you use don't you use medication anymore. Sometimes they're not from medical product developers. Sometimes our peer councils are convened like that example that I shared of the media kit. So that was just about the experience of depression. It had nothing to do with any particular treatment.